You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com.
Episode 144, The Paradox.
Welcome to The Paradox with your attending, Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun and informative format through expert analysis. And today's expert is Ron Barshop. Ron is the host of the Primary Care Cures podcast, and he has a lot of experience within the medical industry, both as an entrepreneur and as an angel investor in some startups. And today we're going to talk about direct contracting. We talk about this quite a bit in the show, at least with direct primary care and the ability to skirt around the third-party payer system that we have in the United States. But Ron has a wealth of knowledge when it comes to how big this is, who's doing it, and what sort of things are emerging in the market. And as you'll find in this discussion, he's going to make quite the case that this large, decentralized movement is really starting to pick up steam, and it's saving so much money that businesses are having more and more difficulty in not doing it. And so you'll find that the direct contracting by instead of working with an insurance company to put together a package, that by separating the services and negotiating them separately, and in some ways making a bit of a closed network like there used to be with the HMOs in the 1990s, you have tremendous cost savings to the point where employers can now pay their employees more. They can provide free healthcare totally, where there aren't even any copays if they use the right places as far as getting their care, surgeries, laboratories, imaging, etc. And they can also provide other benefits like paying for college for their employees or putting the down payment on their first home. There are all sorts of possibilities when you have a tremendous amount of capital that's freed up that was previously going to healthcare, and you're going to have better retention, and oftentimes because of the care they're receiving, which is now built upon direct primary care or more of a personalized concierge type of medicine, that you're actually getting superior care, less problems with people being homesick, less recidivism, less turnover, especially with your workforce. And that saves alone a lot of money, even outside of just the healthcare savings that you get from, people spending less on an x-ray. This is the kind of discussion and the kind of thing that really gets me excited about healthcare, really gets me optimistic about what potentially could happen. This is the stuff that should make us all hopeful. And I think if you're a business owner or you're someone who has an employee at a place or has a ability to make decisions, something you should really look into if you're in the HR or something like that, because there's a potential huge amount of savings that you can bring into the bottom line of a company. And nowadays, with the labor market being so tight, anything you can do to attract or at least at a minimum retain workers is something you should definitely look into. So you're in for a really fun discussion. As always, you can go to theparadox.com/144, where you can find show notes and links to things we talk about in the show and ways of finding out what Ron is up to online, either through LinkedIn or through his podcast. But first, at your practice, what happens when staff call out sick? How much time does it take to find replacements who can fill in? If you need to cancel appointments because you're short-staffed, what does that cost your practice? Deputy is a simple app that's helped more than 250,000 workplaces tackle this problem. Deputy makes it easy to schedule staff in line with patient demand, communicate schedules with your team, and instantly find replacements when someone calls out sick. To learn more and try Deputy out for free, go to drpodcastnetwork.com/deputy. Finally, just a reminder, if you have show ideas, the people you think I should interview, or topics we should discuss, I'd encourage you to email me at theparadoxshow@protonmail.com, or you can visit the website at theparadox, and that's DOCS.com, and track me down that way. But without further ado, Mr. Ron Barshop of Primary Care Cures on direct contracting is fixing healthcare. Enjoy. Hello, I'm here with my new friend, Ron Barshop. He's the founder and CEO of Beacon Clinics, a national ancillary leader in allergy testing and treatment. His podcast, Primary Care Cures, has been named to several top healthcare podcast lists and presents thought leaders and CEOs of models that are fixing primary care, and by extension, most of what's broken in healthcare. A lot of things we talked about in this show. He's chaired 2 Angel Networks in Austin and San Antonio. He's completed 10 marathons and won national and local leadership awards. And he's authored Healthcare is Fixed, which will come out this fall. Ron, thanks so much for joining the show.
Hey, thanks for inviting me. I appreciate it.
Well, I was just saying before we came on, I really appreciate your show. I enjoyed a lot. Primary Care Cures. I have not actually mentioned on the show before, but I'd highly recommend it for anyone who's interested in healthcare. Our circles sort of overlap as far as our I think I've got a little bit broader sort of subject matter, but certainly looking at people who are innovative and disruptors in the healthcare field, we tend to sort of have the same focus, I think, as far as the show goes. Why don't I get your background, I guess, and how you got involved in healthcare? Because you're not a physician. I mean, I don't have all physicians here. I have people who are in the healthcare field. So exactly explain how you got involved in all this mess.
So I started an angel network after learning how from a group in Austin that I chaired when I was in my 20s. And then in my late 20s, I started a San Antonio network that funded what is now the largest technology company in San Antonio's history, a company called Rackspace. They had more profits than the largest employer in town by far last year, and they're much smaller. The Angel Network had a company approach a gentleman who was doing physical medicine inside primary care, and he was making about 10 to 20 times what a chiropractor should make, and the doctor he was with was making about 3 times. And so we turned that into a business, the scalable business. It grew very fast. I found myself in arbitration because we were making so much money for the doctors that they didn't respect us anymore. And it was the Scarlett O'Hara model, which is kindness of strangers, hope they pay you. And anyway, after being in 2 arbitrations, I just said, I'm going to boot this model and start something new. And he started an allergy company and I started one, and we became the 2 largest in the country. Since COVID, I don't think I'm in the top 10 anymore. I don't even know if there's any left, but we test and treat patients inside primary care offices. They're largely fee for service, which I have now learned is a dying breed, clearly, from what I've done on my primary care cures. So, and the show grew, which might be your next question, maybe not, but the show grew almost like a crime scene. It seemed like fee for service was dying and I couldn't figure out what was going on. And I wanted to Sherlock Holmes it, I wanted to get the smartest people on to talk about it. And I knew a few smart people, but they had a real good network, all of them. And what it ended up turning into is direct primary care really is a winner in the circle of life called primary care. And it's going to survive long-term because it's just so elegant and simple and clean. But it's also not scalable because if you're a larger employer living in Michigan where you live, you can't hire a DPC if you have offices or, in other parts of the state or other parts of the country.
Right. So
DPC is a beautiful model for the doctors, but employers really who want it badly can't figure out how to do a deal with 12 different mom and pops. So then I started finding that, wait a minute, it is scaling, and it's scaling very nicely in Colorado. And wait a minute, not just Colorado, in some other, not just other states, it's scaling across the nation. And so I've had the CEOs of 30 million employees. In other words, they are servicing Fortune 100s, about a third of them. They're servicing most of Silicon Valley companies we've heard of because they have to be early adopters to recruit and retain. A direct primary care model that goes way beyond primary care and does a lot more than that. We could talk about that in a minute. But so basically, allergy turned into podcasts, which turned into a crime scene, which turned into an elegant solution that's scaling beautifully across the country and is a much bigger solution than I ever imagined and is pretty much solving every problem in healthcare. So healthcare is fixed indeed.
Yeah. And I think when I started my show in 2018, I was very pessimistic. I've been in private practice since 2004 doing anesthesia. I'm as vanilla as a practice as you have. It's a single specialty independent group. We have exclusive rights with hospital systems and insurance based, all those sorts of things. And so there's nothing innovative about what we do. I mean, I think we're really good at what we do and we have good billing and all those sorts of things. But, and so looking at healthcare has changed quite a bit with Obamacare or Affordable Care Act, and you see the increasing prices and the rancor that goes on. And so it's easy to get discouraged. You see all the things that are happening and things that are frustrating to your life, like electronic health records and things like that. And when I started the show, I never had an intention of being optimistic about medicine. I was convinced that a slowly sinking ship, I guess you'd say, at least to what I think would be functional, what people would actually like either to work in or to receive care from. And I have been very encouraged by all the people. And I think, to your point, the people you're talking to, I mean, there are solutions out there that people are finding. And why don't you talk to that a little bit? Because I think we oftentimes look for an elegant legislative solution. And I mean, I've become more and more convinced that legislation is not where you get fixes in most industries, and certainly healthcare is one of them, even though it's highly regulated, that the solutions are coming from, regular people or entrepreneurs who are finding ways to, and despite the legislation, they're finding ways to deliver that care that people want.
Well, let me quote from Dr. Keith Smith started the Surgery Centers of Oklahoma, and he was my funniest guest. He's not Jim Carrey funny, but he's just witty. And he's really the earliest pioneer in the Free Market Medical Association, founded that organization and posted the first basically transparent pricing for surgery in America. And UCLA has literally cut and pasted and put it on their website, their surgery center. And now there's the Texas Free Market Surgery Center. They're in California, they're in Oregon, and they're popping up everywhere. In fact, I'm talking to one today at 4:00. One of the Sean Kelly is head of the Texas Free Market Association. So, Texas Free Market Surgery Center. So, the big picture here that's going on is, it appears. And by the way, what Keith Smith said was, he said, "Don't expect the driver of the getaway car to solve the caper." So, Congress is not going to be fixing healthcare anytime soon. And in fact, it does everything it can to keep legacy care where it is: sick care, wealth care, and poor care. There's 10% of Americans get great care, and the rest of the 90% are either functionally uninsured, or desperately, one or two medical bills away from bankruptcy. So it's a functional uninsurance problem, number one, and it's a maligned incentive system, which is overstated but so true. And this new model really fixes both of those problems in a beautiful way, where the dock worker is going to get the same care as the CEO who put the benefits in place, who's going to get the same care as the brand new person who started yesterday. So think in terms of like, what's better than free healthcare with no friction? And that's what this new model is really rolling out in a large scale. And really, since you started your show the same time I did, it's really, since then is when it started to scale. It's like literally a hockey stick, and it's an unstoppable movement. It doesn't have a name. It doesn't have a leader. It doesn't have an association. There's no academic studies about it. But you can call it direct contracting, because you're direct contracting not just with primary care, but with specialists like you, because you have a cash pay rate, don't you?
Yes.
Yeah. Mm-hmm. And everybody does, except for MD Anderson in Texas. They all will take cash, and it's discounted because you don't have to bill and collect, no pre-authorizations. You don't have to screw around with insurance company clerks on the other end of the phone waiting forever. And so you'll take cash all day long. And pretty much every part of the ecosystem will, including hospitals, including rural hospitals who desperately need it. And so really the most interesting things I can do for this show, or at least for your listener, is to go into some examples of how this is working, I think.
Yeah, please. Yeah, if you give an idea, I really impressed at the beginning of your show where you often talk about the scale, because you have the numbers and sort of, how many Americans are affected by this, and how much the healthcare is, in different sectors and delivered in different ways. If you could go into those details, it'd be, real. I think
there's 170 million Americans that are working for somebody, and most of them are either on a company plan where Blue Cross is their insurance company, or it's self-insured, which is really the fastest growing. So that market share where Papa Bear Blue Cross or Papa Bear United or Aetna or Cigna, they're no longer, those plans are forever increasing in price. So those are shrinking. That's not a growth market. What is a growth market is self-insured. So people are shifting over and saying, well, I'll take the risk. I'll write a catastrophic, gift wrap around my plan, so I don't have any cancer or car accidents or cardio that's going to scare me in my population as an employer. But then I'm going to put in a plan that's going to be, I'll pay for it all. I don't want to get the middlemen involved, the PBMs and the insurance companies. All the PBMs stay involved in some plans. And then there's this third that's most exciting that I think, and it has just taken off in the last few years, I'm calling it direct contracting. It could be called near-site or on-site clinics. And it's not just primary care. It's direct contracting with specialist surgery centers. It's contracting with a wholesale pharmacy often, or a transparent, thinly margined PBM who discloses their 10% on both sides. It's going to be involving a lab and imaging that's usually independently owned. So instead of imaging costs that are 4 to 6 to infinity times the independents all have pretty set pricing, not unlike the surgery center I was describing earlier in Oklahoma. So you can literally go online and see what each imaging center is going to cost. And so employers can now make better choices and put in almost like a narrow network, the old HMO days when you say, go to these people and you'll do better. So the employees in this third model can now go to their pre-contracted doctors and specialists, or if they like their labor and delivery doc and she wants to definitely stick with that guy or gal, they can contract with them for cash. So what will you take for the surgery, for the delivery? Well, $6,000 to $7,000. Okay, we'll pay you $7,000. What if there's complications? There won't be any, but if there are, a little bit extra. Okay, so they contract that in with everybody. So every doctor will agree to some kind of negotiation like that. And it's a lot of heavy lifting at first until you get everybody satisfied. And maybe not all the employees want to elect to this direct contract because it's scary. Now it's free. There's no premium. There's no copay. There's no deductible. There's no coinsurance. But maybe a third of them will migrate quickly because free sounds pretty good. And then the other 2/3 will stick with the old PPO or HMO plan. So, I'm scared to leave IBM, right? I don't want to check out of the name brand that I've known and trusted for, a long time. So, but eventually they will migrate over to free because free is, the most powerful word in the English language. So it's now some employers rip the Band-Aid off and it hurts, ouch. And they just go, we're just going with the direct model. We're not going to do that old stuff anymore. And the ones that have been on my show, and I'll just tell you a couple of stories. One of them is a drywall contractor that's the 5th largest in the country. And nobody can touch their craftsmen. They're the most hard to find, skilled people on the universe. And there's just a super limited amount. And so labor shortages are the big problem. You can't go for more business unless you get more craftsmen. This gentleman, Paul Cole of PJD Drywall, Cole Johnson, I'm sorry, is the CEO's name, not only saved on his workers' comp several $1 million, he was at a sky high, like 65% above the normal for his industry. And he went to 40% below the industry because he had 3 million work hours of unlimited health because he now had access to primary care and a chiropractor free on his plan. So they went immediately to go see somebody instead of filing a workers' comp and then, go and get an occupational health, watching videos and watching Oprah all day long and waiting for God knows what. And so, this whole workers' comp gambit is kind of a game. They want to work. They don't want to sit at home waiting, and they want to get better. So the beautiful thing is his workers' comp dropped, his health insurance premium dropped about 40% as well. He poured those millions of dollars instead of into his pocket into free time off, because drywalling is a seasonal up and down event. It's tidal waves. And so during low season, he still pays the employees during paid time off, even if they started day one. And he gets it too, by the way. Of course, he's always working. And then the second thing is they also get housing assistance. So he helps them make a down payment on their first house often. Wow. So they can move into a nicer neighborhood. They can be more stable in their life. They're better workers. And boy, do they appreciate that. And then he's done a half a dozen other benefits. So he finds that, again, his craftsmen are untouchable. He's the largest for sure in Arizona and Nevada. And he works mostly for public companies that are housing companies. So beautiful model. You ask Cole, would you ever go back to the old legacy Aetna Blue Cross? And he'll just laugh. The second guy that laughed was the cable company basically in Tyler, Texas. Now, this is a smaller story. It's maybe less than 1,000 employees versus 3,000 to 4,000 I just mentioned. And that company has on-site, so they have on-site doctors, but they also have direct contracts with all of the 5 in what I call the hand, the pharmacy, the labs, the imaging, the doctors, and the specialists. They have direct contracts. Their costs are so low that, again, when I asked the CEO, Mr. Kano, would you go back ever to legacy, plans? He just said, I can't now because I'm saving too much money. My employees love it. They're all healthier. They have no friction to go see the doctor anymore. They have a phone number they can call or text and get to see, virtual care immediately. The third story I'll tell you that was on my show is just kind of blew me away because it just happened last week. But the state of New Jersey did some of this, and the state of New Jersey hadn't made a pension fund payment to what it should. It has not been fully funded for so long nobody can remember in recent memory.
Yeah,
they did. They finally did this year because they saved $1.5 billion a year with their director, who's a visionary. And so Chris Deacon basically she did a reverse auction, which means you tell the pharmacy companies, the pharmacy benefit managers, keep lowering your costs until you get to the rock bottom and give us the maximum rebate, give us the lowest cost. And so reverse auction is the opposite of a regular auction, which goes higher and higher. Now you're the buyer and you want it to go lower and lower. They saved, hundreds of millions on our pharmacy costs just with that little technique. And then they did the same thing with direct primary care. But they had the political will. I just talked to another state director that she referred me to of an equally large state I can't mention. The governor didn't support it because the hospitals had him in their pocket. Right. The lieutenant governor, the hospitals had him in their pocket. Now, the state treasurer badly wanted to do this because they've got the same problem with unfunded liabilities and pension plans, health premiums that are ever increasing. And so they didn't have the political will to do what New Jersey did. So it takes a village to want to make this happen. And it takes a governor with a little bit of vision who will give you the political cover you need. But what they did in New Jersey is they gave everybody a month holiday from paying any costs of premiums or anything. It was a beautiful thing. And the last story I'll tell you is RosenCare is a famous, in our circles, example of it's a hotel chain with 6,600 rooms. They have about the same number of employees, and they have, since 1994, saved over $430 million using direct contracting by having on-site clinics and on-site gyms that's state of the art, and every kind of imaginable care you could need for $5 a visit. They have now funded all of the college educations for their employees that want one, which Walmart just agreed to do they saved $1 billion doing some of these models too. But Rosen, what they call, has also funded now the neighborhood. Tangelo Park was the most drug-infested, gang-ridden neighborhood surrounding the convention center in Orlando where they are. And it's now essentially drug-free and crime-free and gang-free for over 20 years now. And they have a college graduation rate that's in the top, that would match the top quartile of the richest neighborhoods in America at 78%. It used to be 14%. So and their occupants, their turnover went from 75% down to less than 12%, which in hotels unheard of. But again, they just pour their money back into their employees. They pour the money back in the neighborhood. And Mr. Harris Rosen just adopted a neighborhood 5 times the size of Tangelo Park. So just try to imagine if you took this money saved, these $430 million, got rid of all your corporate debt, which is what they did. Now you start investing it in the neighborhood around you. Do you think you're going to ever have a crime problem again? If every city had a sort of paternalistic or maternalistic company like Rosen Hotels, this country would be a different country.
Yeah, well, and I think it just is certainly shows you the tremendous wealth this country has and how much money we are, I guess you just say, throwing away, right? That we spend so much more than we need to receive services, which, to your point, we're contracting, it's the same person providing the same service, the same surgery, the same, primary care office setting or whatever. And you've just removed all the middlemen. And and I always am careful to say, there is utility in having middlemen, people who organize activities between groups, large groups, corporations, or individuals. But they're far more than we need, and they're oftentimes not doing anything that's useful, except it's a regulatory capture sort of device, like through PBMs and such. But it's actually, when you go through those numbers, and I've listened to your show, I'm like, this can't be true, right? It's too impossible to think that there's $1 billion just laying around that people are getting care that's actually better than they were getting before, more personalized, and you're saving $1 billion that you can actually spend to, especially in today's time. You want to be able to retain your employees, good ones, right? I mean, because it's hard, labor's hard to find, good one, and we're going through the same thing with our company. We're looking at this sort of thing partly through your show. I heard, with Katie Tepton that you've had on a couple times. She's fantastic. But I wonder how much longer this is a secret. I mean, is this a secret anymore, or is it just a secret from the public? And when it comes to CEOs, when you're talking to other people who are in other industries, maybe, do they kind of see what's going on and they're like, okay, that's our next move because we have to somehow control one of the largest expenses you have, right?
I just spoke in San Francisco to a group of doctors, and the second year I've spoken there. They don't know what the heck I'm talking about when I talk about direct primary care. They go, is that concierge red carpet stuff? Kind of, but not really. I mean, think of concierge care for the CEO and the dock worker, and there you're close. but it's not even, because that's for rich people. This is for everybody. Blue, white collar. It's, age unspecific. It's just every worker gets this same care. I've been doing it with my own company now for such a long time that I just my absenteeism is essentially almost zero. My losing people, my turnover is almost zero. When I recruit, if I need 5 positions, I used to have to talk to 60 MAs to find good 5 A players. I talked to on the 6th one, my people say, we're done for the day. We're going home at 10 o'clock. I'm going, you got 40 more interviews. They go, no, we're done. We got A players this time. It's like, and I suspect that's going on at LinkedIn, who's doing this. It's going on at Apple, who's doing this. Apple, in fact, took a company public who just bought Iora Health, who's been in Marty McCary's book and Marty Macary's book and others. I think, is it getting out there? Not really. It's still a little bit of a secret. So the early adopters, Silicon Valley, a third of the Fortune 100, a lot of small employers. 30 million is really, it sounds like a lot with 160 million employees. That's almost 20%. But it's still a secret, yes. And why is it a secret? Wow, because we don't have an association. We don't have anybody doing academic studies. We're not going on doing Twitter feeds and so using social media, because there's nobody organizing. It's just right now it's a herd that doesn't have a alpha in it, and, which is an opportunity. The beautiful thing is that it's an unstoppable movement because there's 5 winners. The first winner is the doctor who no longer we don't have any indications of suicide or burnout at all, when they now are seeing 5 or 6 or 7 patients in a panel a day instead of 25 in volume medicine. Right. And the doctor also didn't have to do EHR, except for the first year, to show the employer, look what the codes were last year, look what they are this year. For asthma, they've gone way down in cost. And we can show reduced ER visits and hospital visits. And then the second one is the employer, obviously, is the big winner because their outcomes are better. Their chronic conditions are now managed for the first time. Medications are managed for the first time. But you also have lower utilization, less dumb tests and dumb procedures, and less stupid surgery. Like a lot of spinal surgery is unnecessary. It resolves itself in time, about 80%. So employers love it. The employees obviously love it because they now have frictionless free healthcare, and they have a doctor for the first time that they can call without worrying about copays and deductibles and premiums. So, and then the costs go down. So that's the 4th measure in the quintuple aim. And the 5th one is population health. Our outcomes are getting better by every measure you could possibly measure. They're certainly maintaining, but they're getting better by 10. I've seen as low as 8-10%, and I've seen as high as 40 to 60 to 80%, depending on the providers that are putting this plan in place. Everybody wins. So it's unstoppable.
Right. And I think, that's the key for having something successful. Like, I've had people on the show and they say, what we need to do is we need to have transparency with hospital pricing, for instance, that hospitals, we need to be able to look and compare pricing for, gallbladder at hospital X, Y, or Z in town, so we can find the best price. And so that we can maybe provide some sort of incentive to the patient to make that decision. The problem, of course, is that there's not enough of incentive for anyone to actually bother figuring that out. And ultimately, if people were in control of all the expenses, that would take care of itself. You wouldn't have to pass legislation to have a transparency because it would be an expectation, right? You couldn't have mysterious pricing. No one accepts anywhere else in their life, in the economy, except apparently in healthcare. And I don't know, maybe like government budgeting or something like that. But I mean, for the most part, it's just not, it's something that's solved just by the market forces itself, which makes it so elegant and simple. And to your point, and why it's so powerful.
I read it on a website today of a big hospital system. The reason we're only 10% of the hospitals have fulfilled that mandate by the President Trump to be transparent. And Biden, to his credit, doubled down on the transparency, but he gave a Willy Wonka pass to the Medicare Advantage plans because United has a really good lobby, and so does Humana, and so does AARP, who does the bidding of United. So the cool and ambulances, they don't have to provide their information either, but there are some carve-outs. Like any kind of healthcare gambit, there's always games being played. But the beautiful thing about transparency is it's going to help the other people that aren't in direct contracting. When you're in direct contracting, you don't care because what a birth, like I said, the birth is going to be $6,500 to $7,500 depending on the market. And if there's complications, there's ways to even subvert those. So I have a friend in one of the Western states who has a big direct primary care group, and every pregnancy was coming, every delivery was coming back with complications, 100%. So they started calling the nursing staff ahead of time. Hey, you expect any complications? No. I'm going to call you after see how it went. Hey, Dr. Larson, no complication. He's a pro. And then they called Dr. Larson after, and they tape recorded. And hey, Dr. Larson, any problems? Hey, man, I know what I'm doing. Complications, phooey on that. And so of course, they called the patient next and said, the bill's going to come in. It'll show complications. Ignore the bill, but send us a picture first, and then we'll handle it from there. Throw it away. Don't worry about it. Of course, you know what they did with that when the complications came in? They called and said, must be an algorithm. Clearly, this is not human error. You would never add a complication that doesn't exist and overcharge. The new game that hospitals are playing now that you got to call them on is CMS has told the hospitals that there will not be any auditing for upcoding for COVID everything. You got a bloody nose,
right?
That's COVID. You got any kind of ankle sprain, that's COVID. So you got to do COVID test. And then the tests themselves that cost them $17, they're charging anywhere from $70 to unlimited. When I say unlimited, I've seen as high as $9,000 for tests that cost them $17. So right. Infinity, it's ridiculous. So there's a good third-party administrator or a good advisor is going to adjudicate those claims and say there were no complications on the delivery. We're not paying for COVID that didn't exist when they had a sprained ankle, and we're not going to pay for a test that didn't ever happen.
And then what do you look for companies that are smaller? So it's easy to say, well, Walmart, they're huge, they're nationwide, and they can figure out the infrastructure problem as far as ways of direct contracting things, or even a large employer in town with 4,000 or 5,000 employees. What do you say to someone who's got 10 employees or 100 or 200? Do you still see that direct contracting is a reasonable route to try and cover their employees?
Yeah, there are companies that specialize in smaller employers. I'm really good friends with Dave Berg, the CEO of Redirect Health, but I've been using them for 4 years. I'm paying $140. Plus I use Sedera, which is in Austin, which is a faith ministry that's a sharing arrangement. And so if there is cancer, or if there is a car accident, or if there's a heart attack, I'm going to have them basically pick up that cost. That's what you'd call catastrophic in a larger plan. And so, I have a phone number I can call. I use the Spruce app. I can text or call. I've done it 10 or 12 times this year for little things, nagging backaches or a chronic cough. I was a little concerned. I have to go get a lab test. So they're great. I mean, they do everything for me that a larger company would do. And my employees love it too, because they're not leaving me. Like, I can't chase them away with a stick. They love, and it's free healthcare. Think about it. It's not me. I don't have good breath. I mean, I'm not exceptionally handsome. They're working for me because we have a really good company to work for and a good culture, but more importantly, we have free healthcare, and free healthcare is rare. They don't have to have their kids wait in a Medicaid clinic anymore with hacking, coughing, yucky people. And, they're in the sick ward when their kids got pink eye. They already know they got pink eye. They can call it in. They've seen it 10 times. The kid's got an ear infection. They know what it is. Does the doctor really need to physically see every single pediatric case? It's a half a day away from work. And if the kid's really sick chronically, it's, a half a day a lot, and it affects their career. So they don't have to do that anymore. Their husband has sleep apnea. They can sometimes call it in and get a sleep test, and it's all free. I mean, it's a beautiful, beautiful thing. Have you ever heard of patients assistance programs?
No, not.
I'll help you get a guest on your show to talk about them. But if you make under $15 an hour, it's free. Healthcare is free essentially for every imaginable, mostly drugs, but also procedures, because there are faith-based ministries, there are pharma companies, there are charities, there's family wealth groups, there's corporations, there's cities and counties and states. There's all kinds of programs out there, and it's a swamp. It's like individually, you and I wouldn't be able to figure it out, but that's what Redirect does for my people is they navigate the swamp, find the right plan, get it paid for, so there's zero cost to Redirect or to my people or to me. And it's again, it's not just care, it's navigation plus care. And not only navigation into the more complicated care, but navigation in the morass of free care, because there's a lot of free care out there.
So, if the way we're talking about right now is a radical transformation of the healthcare industry, and we're talking, and I think, you and I would probably both agree that the economic forces are certainly moving towards that solution, because that's just kind of where it's going to end up. The two barriers would be, you have obviously government payers are a large portion of healthcare in this country. I mean, 50% of people get it through Medicare and Medicaid. And so they have a large influence within the regulatory environment, I guess, to get their health care. And so that is controlled by people who have a lot of money, which are PBMs, hospital associations, insurers, right? Those are the huge lobbyists, I guess the AMA, to some extent, AARP, like you mentioned earlier. And so that's obviously one barrier to keep the system as it is now. You have all the other, and then you have the other thing is you have a number of people who aren't employed by someone. So they may be either, or they're self-employed, they work from home, or they have, they run a restaurant, they've got 3 people or something like that. That seems to be where this system sort of will maybe have a breakdown. Is I feel like the next thing to fall would be finding some solution for those people in the really small employers, or the people who have to fund their healthcare on their own, like a dentist, for instance. How do you see that getting solved? Because once that falls, then you're going to have sort of 2 systems, right? You're going to have this, really good system, and then you have people on Medicare, Medicaid who are like, yeah, this doesn't make much sense. There's a way we can get sort of what my kids are getting or whatever.
If I was a dentist, I just went to go see my dentist in Houston yesterday. There's a direct primary care doctor 2 floors below her she didn't know about. She's got about 12 or 20 employees. I introduced the 2 of them. I mean, it's a simple thing really to find a DPC. There's a thing called DPC Frontier, and you can find any direct primary care doctor in your town. And then I would call Sedera or Zion or one of these other faith-based ministries like Liberty. There's a lot of good ones out there, and you can, again, take care of that scary stuff. It's a little scary to jump off and do nothing. Well, it's scary to do nothing, but it's scarier for people to jump off into a name brand they've never heard of before. So again, I can tell you that when I walk out from an appointment with my Redirect Health, and by the way, every doctor is a Redirect Health doctor, because I go in with a Visa card number that they send me just before my appointment, and I walk out and they're now scanning that digital card. So they're paid in cash before I leave. And the doctor loves it. Every time I go see a primary care doctor, and I've seen 2 or 3 different ones because I've lived in 2 or 3 different cities, I tell them I'm your most profitable patient today, because the $70 you're getting from me has no billing, no coding, and no pre-auths, and it's just cash. And it's like today you're getting paid. You don't have to wait 90 days. There's no chargebacks. There's no recoupments. You didn't put the dotted I over Ronnie Barshop correctly. So, without that dotted I, we're going to take our money back. You criminal. They don't nobody likes to get the deal on the phone with these giant middles. And it's not care that's expensive. It's not a bill. It's $1 trillion that, we're talking about here, because the primary care doctors in America are getting about 27 cents on the dollar if they're independent, and they're getting 18 cents on the dollar to as low as 8 cents if they work in a system. Where's the other 70 to 80 cents going? It's going to this administrative class that has risen like, the fungi in the ocean. I mean, it's like the grand, it's like, it's just
it's an algae bloom. Yeah.
It's a bloom. It's an algal bloom, and it's growing. And the problem with that fungal bloom is it's not cheap. And everybody there feels like they have to do a job. Have you ever been on the phone and you got denied something, and you're the doctor and you know the patient, and you know the history, and the person on the other end has no medical background?
This is the reason I went into anesthesia. I don't have that problem, but I talk to plenty of my friends who do.
Well, yeah, it's to imagine that you've gone through 20,000 hours of training, a lot of sleepless nights for 3 years, and to have some numbnuts on the other end, some dweeb who is a self-appointed expert who just started yesterday and was trained to tell you give you a denial on a medication that's working beautifully. The anesthesia, you guys, I see why you picked anesthesia. You're a smart man.
I like fixing problems quickly. I don't like having to fix a problem over 6 months, your blood pressure. But I talked to my friend who's a urologist, and he talks about this all the time, where he has a prior authorization issue. He calls the company, and they're like, oh, well, sure, you can talk to a doctor, and they'll call you back in a week or something. They call back, and it's a dermatologist who knows nothing about urology. And he's sort of, yeah, probably you're right. I guess, yeah, we'll approve this. But it's, now been 3 weeks, and this person had they have prostate cancer. They needed some treatment. And, there are real issues, that these are real people who are having problems getting care. So, without a doubt, a lot of these things, I think we just accept a lot of these, this sort of learned helplessness within medicine, because we are employed, or because that's just the way things were. And they obviously have bigger lobbies, and you don't know about these options, right? I think I look at direct primary care in my town, and we've got quite a few. We've got probably a dozen in a city of about 500,000, a metro area of 500,000, which is quite a few in today's day and age. But I'm certain it would quadruple, quintuple if there was a huge enough market people looking for it, right? I know a lot of docs who'd step away and immediately go into direct primary care because the stuff they don't like are the things that direct primary care solves for the most part. I see it as it has the potential for exponential growth. It's still, I think, linear. When you talk to people who are DPC, they're like, yeah, it's growing, but it's not that hockey stick yet. It's like maybe getting close to it, but until you get more of this sort of contracting, I suppose that may be the key. Once enough people start looking for it.
So direct primary care as a mom and pop Kool-Aid stand, and there's some that have 2 or 3 or 4 locations, but mostly they're mom and pop Kool-Aid stands. It's a beautiful thing if you're a patient because it's very intimate. It's like old school Dr. Kildare or Marcus Welby. Today, it's more, like really a hospitalist to sing you've never met before. But what the problem is, there's only 2,000 practices that we know about today, and that represents 500,000 people if the DPC Alliance is accurate. Well, 500,000 people, is not a earth-shattering number after 20 years. It's pretty embarrassingly low, and it's not scaling fast enough to make a difference. Although there's a lot of, and I've had all what I consider the Mount Rushmore of thought leaders in DPC on my show. Again, that led to companies. There's a company called Premise Health, and Premise Health is a roll-up that now has 11,000 members that are patients. They don't call them patients, they're consumers in this world. So patients are passive, consumers are proactive, and they're in charge of their own health. Premise has 12,000. There's another company that has more, and it's called Medici. Medici is now virtual only. They're not in bricks and mortar like Premise is, but that's 25 million right there. And that's not even including companies like Crossover, who's helping Amazon in all of their locations now. That doesn't include One Medical, who just went public a year and a half ago. One Medical is now helping Apple as they kick out. And again, they didn't get it all at once. They're growing at 60% a year just with Apple alone. There's a company called Everside that's known as Paladina in Colorado. They're now helping the state of New Jersey, as I learned on my phone call with the director. And they're also helping the state of Colorado and some very large school districts all over the country. So they're at close to 1 million. Crossover's close to 1 million. There's these companies down there that are starting to get scaled. There's a lot of them at 100,000, 200,000, 500,000 that are doing, maybe some are doing mental health. There's an interesting company called 98.6 that's helping Walmart. And 98.6 is got some mental health in there. And it's very inexpensive. It's like $20 to $30 a month. So it's a member per month fee. And all of these companies, again, when you add them all together, and I haven't had all of them on the show, I'm sure there's some companies I haven't even heard of that are, cropping up. So little by little, I'm starting to get, they're finding me, I guess, because I'm the only show that just kind of exclusively talks about this new primary care where it's virtual first. And then there's mental health often included. There's a company called Nice Healthcare in Wisconsin that does home visits only. That's it. They come in with a mobile x-ray. They come in with a bunch of other lab tests. They come in into your home. They'll do your whole family for $20. It's ridiculous. They're going to Utah next. I don't know how they're like, it seems to a bit of a race to the bottom in this virtual model, but somehow, the venture companies want to see this happen. So, but what the fallout of all this is there's going to probably be in 5 or 10 years, 3 or 4 or 5 big companies that have rolled up a lot of these smaller ones that are growing, and they're now getting scale and they're now getting a reputation. There'll be an association. There'll be academic studies to prove how costs are going down. But I'm finding the smaller, more agile ones are the ones that are getting the biggest savings for the employers. And then there's one big giant one that I'm super excited about that's going public in another less than 30 days called Babylon Health. Now, have you heard of Babylon?
I have not, no.
I'm sorry to monopolize this show, but anyway, Babylon Health.
No, that's why I had you on.
Okay. Well, Babylon Health is very exciting. Babylon is run by a brilliant visionary named Ali Parsing. And Ali's done something nobody's done before. He wants to take care of everybody on the planet Earth with better care. Like, that's a pretty big mission, right? So he has got 23 million members. They're digital only. They're AI intensive, more so than probably anybody else I've seen. They have, I don't know, they're on every continent. They're on all 5 continents. And then UK, they're the largest primary care group by far, because of all the digital interactions they're having. So if you look at just patient visits, they're by far the largest PCP group in the UK. And they hit the shores of America a couple years ago. They have 3 million here, and then they have 100,000 in this direct model. But the 3 million are what you call value-based care. So you talked about earlier, an older population over 65. They have a capitated amount. So let's just make up a number. They get $10,000 per patient from CMS. And if they deliver care for $9,000, they make $1,000 a patient. If they deliver it for $11,000, they lose $1,000 a patient. So they're in a value-based care model with capitation, which is the same model as ChinMed, who's been on my show. A lot of people have heard of ChinMed, who just got in Houston a couple of weeks ago, and I just talked to their medical director this morning. We've had companies like Catalyst Network in Dallas. They have 1 million patients in Texas, which is only 14 million people, 15 million people. We have another called Village MD, which signed a deal with Walgreens, $1 billion deal. They want to be in 700 clinics. They're already in 10 or 20 in several states now. So Village MD is going sort of a value-based care retail clinic model in the back of Walgreens. So Walgreens tried doing it themselves. They need a partner like Village MD in Houston with Clive Fields that knows what they're doing. And so they finally found a really good partner. But, I don't have any criticism when I see, is care better for the patient? Is it better for the doctor? Is it lower cost? Is it getting better outcomes? And is it doing it in a way that the employers are happier? In this case, CMS is happy because they're delivering it for a capitated amount. So they're able to protect their cost risk. So as long as you got those 5 winners, I don't give a hoot how care is delivered. Again, net promoter scores tell you everything. People like to poke holes at models and say, then why do they have a net promoter score of 95 and a Google rating of 4.7? You tell me. You explain that to me. I get mad at people that poke at primary care models. We've got to experiment. We've got to try new things. And I think we finally found 2 experiments that work. Value-based care for older populations and direct primary care, direct contracting really for the larger ecosystem for the younger population.
Yeah, well, no question. And I think, innovation and the ability to experiment and to fail and succeed is really what we're going to get, the real solutions that are going to solve our problems. And we've been stuck in a rut for as long as I've been practicing medicine, even when I was in medical school, because the exact same things we're talking about today are things that were problems in the 90s. And if anything, some of them have gotten worse. But again, I'm more encouraged in general because I feel like there's more innovation. And with the onset of the digitization of the world, it has certainly opened up a lot more opportunities for breaking out of the traditional model, which I think is definitely a threat to hospital systems and sort of the traditional, players in the space. Well, Ron Barshop, thank you so much for being on the show. I absolutely have to have you back once your book comes out. We need to talk about that. So I can find out, since someone finally will fix healthcare, it'll be great to learn. I think it's a lot of things we talked about today, but thanks again for being on the show. And I recommend again, everyone to catch your show at Primary Care Cures.
Thank you. I enjoyed it very much.
Thanks to Ron Barshop for a great discussion and show. And before we end, just a quick reminder, if you want to boost efficiency across your practice and make staff scheduling easier, try the Deputy app. You can try this award-winning technology for free by going to drpodcastnetwork.com/deputy. That's drpodcastnetwork.com/deputy.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. And share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/theparadox. Show notes can be found at theparadox.com.